Hello and welcome to Nurse's Handbook. Immediately after the completion of the primary assessment part as per the BLS protocol in an unconscious patient, which includes circulation, airway clearance, breathing and assessment of disability, that is CABD. We will move on to the secondary assessment part as per the ACLS protocol. So here we must know that the most common causes of cardiac arrest are presented as 5 H's and 5 T's. So today I will be sharing with you the 5 H's of ACLS. So what are the 5 H's? First H denotes hypovolemia. Second one is hypoxemia. Third one is hyperkalemia or hypokalemia. Fourth H is H plus ion excess. And the fifth one is hypothermia. The first H is hypovolemia, which refers to the decreased circulatory volume in the body, which is also known as volume depletion or volume contraction. So, what can be the causes of hypovolemia? It can be severe dehydration as a result of diarrhea, severe vomiting, hyperthermia, excessive sweating, etc. Second cause can be any external or internal trauma like GI bleed or due to body fractures, etc. The third cause can be the buildup of fluid in the empty spaces, that is, the third spaces of the body cavity due to acute pancreatitis, intestinal obstruction, hypoalbuminemia, etc. All these causes results in decreased blood flow and loss of perfusion, which can be recognized by certain signs and symptoms. In such patients, when an ECG is obtained, we will find a rapid, narrow QRS complex sinus tachycardia and a weak pulse with increased diastolic and decreased systolic pressure. Now, as the body enters a scale of shock, the heart weakens and eventually stops working. Now coming to its management part. While proper chest compression and rescue breaths helps the remaining volume to circulate, we should get as early as possible an IV access. Secondly, by the side, treat the root cause. For example, applying pressure to the wound. Third, administer IV fluids, blood and clotting factors. Remember, rapid infusion of warmed crystalloids like RL, D5, 0.9% sodium chloride, etc. or blood products are preferred. Coming to the second H, that is hypoxia. It is defined as the decreased level of oxygen in the body. When the lungs incapable of functioning correctly and do not provide enough oxygen to maintain perfusion to the tissues, it becomes life-threatening. The decrease in the oxygen perfusion leads to stress and the buildup of lactic acid throughout the body's muscle. In coronary vessels, this amounts to a loss of oxygen for cardiac muscle, which may lead to tissue death and loss of electrical activity. Now let us see the different causes of hypoxia. First is decreased oxygenation and ventilation. Second is obstructive airway. And third is exposure to certain gases. All these causes can lead to symptoms like restlessness, anxiety, disorientation, confusion. And one may find a bradycardia on the ECG and low SpO2 levels. Cyanosis can also seen in patients, that is, bluish discoloration of lips, palms, pinna of the ear, feet, etc. Now coming to the management part of hypoxia. First is to identify the underlying cause and to correct it. Second is to perform rescue breaths, that is 10 to 12 breaths per minute to be given to the victim. Third is to provide adequate oxygenation. Fourth is to establish advanced airway, that is to intubate the patient as early as possible if recommended. Now let us see the third H, that is hyperkalemia or hypokalemia. Potassium is an important electrolyte that allows muscles to contract and to transmit electrical signals known as action potential through the neurons. Cardiac arrest is likely if potassium levels become excess in either direction, that is too little or too high. Now see the causes of hyperkalemia. They are excessive potassium intake, use of certain drugs like beta blockers, or ACE inhibitors, etc., blood cell destruction, excessive dehydration, acidosis, etc. Now coming to the causes of hypokalemia. They are excessive loss of potassium, use of diuretics in case of alkalosis, and deficiency of magnesium. Now moving to the sign and symptoms for hyperkalemia. In hyperkalemia, the symptoms may include abdominal pain, diarrhea, chest pain, palpitation, etc. And in the ECG, one may find a wide QRS complex and a hyperacute T waves. Now coming to the hypokalemia, the symptoms may include weakness, fatigue, muscle cramps, pain, palpitations, etc. And on the ECG, one may find a flat T wave and the presence of U wave. Now coming to the management part of hyperkalemia. 1. Injection calcium. 10 ml of 10% calcium chloride or 30 ml of calcium gluconate IV can be given as bolus over 10 minutes. 2. Insulin. IV insulin 10 international unit of regular with 50 ml of 50% dextrose or 100 ml of 25% dextrose can be given over 15 minutes. 3. If the patient is in a condition to take nebulization, then nebulize the patient with salbutamol. 4. Rapid injection of IV sodium bicarbonate may be given if severe acidosis or renal failure present. 5. Injection furosemide 40 to 80 mg with saline solution may be given to increase the renal excretion. 6. Dialysis to be done in case of acute kidney injury, rhabdomyolysis, resistant to medical treatment, and to treat life-threatening hyperkalemia. 7. Calcium resonium 15 to 30 grams or sodium polystyrene sulfonate may be given either orally or by retention enema. It exchanges sodium for potassium ions and removes potassium from the body. Now coming to the management of hypokalemia. Little potassium is treated with an infusion of potassium and maintain oxygenation in patient. Correct alkalosis if present. Let us move on to the fourth H, that is hydrogen ion excess, which is also known as acidosis. Any solution with higher concentration of H plus ions will have an acidic pH level, and this may be because of metabolic or respiratory actions. There are two main causes of acidosis. First one is the retention of carbon dioxide in the blood, which will result in respiratory acidosis as seen in cases like brainstem disease, hypothermia, sedative overdose, etc. And the second cause is excessive loss of bicarbonates, resulting in metabolic acidosis as seen in cases like cancer, carbon monoxide poisoning, liver failure, etc. Now let us see what can be the sign and symptoms of hydrogen ion excess in different systems of the body. At the central nervous system, one may experience headache, sleepiness, confusion, loss of consciousness, and may eventually go to coma. In the muscular system, seizures and weakness. In intestinal system, one may experience excessive diarrhea. In the respiratory system, one may experience shortness of breath and coughing. In the cardiovascular system, arrhythmia can be experienced and increased heart rate. In the gastric system, nausea and vomiting. Coming to the management part of hydrogen ion excess is first draw an ABG sample for early assessment. For metabolic acidosis, adequate hydration for renal excretion of hydrogen ion and correction of bicarbonates by infusing them are the treatment. Meanwhile, for respiratory acidosis, proper ventilation and oxygenation is the treatment. Moving to the fifth and the last H of ACLS, that is hypothermia. It is the most uncommon cause of cardiac arrest and occurs when the body's core temperature falls below 30 degrees Celsius or 86 degrees Fahrenheit. Now, what are the main causes of hypothermia? 1. Previous exposure to cold temperature. 2. Metabolic causes includes hypothyroidism, hypoadrenalism, hypoglycemia, etc. Third cause is hypothalamic and CNS dysfunction like head trauma, tumor, stroke, etc. Fourth cause is drug-induced hypothermia, usually like use of insulin and other hypoglycemic agents. Let us see the sign and symptoms of hypothermia. Early symptoms include shivering, fatigue, loss of coordination, confusion or disorientation. Late symptoms include no shivering, blue skin that is cyanosis, slowed pulse or breathing, loss of consciousness, etc. Now coming to the treatment part of hypothermia. The immediate solution to hypothermia is passive rewarming. If the patient is in mild hypothermia, cover them with heated or warm blankets and offer warm fluids to drink. Second is blood rewarming. Blood can be withdrawn, warmed and recirculated in the body with the help of a hemodialysing machine or heart bypass machine. Third, to administer warm IV fluids. The fourth method is airway rewarming. It is done by providing the use of a hot humidified oxygen. And the last one is the warm water irrigation. A warm salt water solution may be used to warm certain areas of the body. The warm liquid is introduced into the area with the help of catheters. Thank you for watching. For more updates like this, do like, share and subscribe the channel Nurse's Handbook.